What are the key social determinants of mental health, and how do they contribute to disparities in mental health care access and treatment? Answer. Social determinants of mental health refer to the conditions in which individuals are born, grow, live, work, and age. These include factors like socioeconomic status, education, employment, social support networks, and access to healthcare. These determinants can profoundly influence an individual's mental well-being and access to care. For instance, income and employment. Poverty and unemployment are associated with higher rates of mental health issues such as depression and anxiety. The stress caused by financial insecurity can exacerbate mental health problems. Education. Lower levels of education are linked to higher risks of mental illness due to limited health literacy and fewer opportunities for better healthcare and coping mechanisms. Social exclusion and discrimination. Marginalized groups, e.g., racial minority (ETQ) individuals, often face systemic discrimination, leading to high rates of mental illness and barriers to accessing mental health care. Access to healthcare. Individuals in rural or impoverished areas may lack access to mental health professionals or treatment facilities, worsening disparities. Public health efforts aimed at addressing mental health must include policies that address these social determinants to reduce health disparities. Explain the concept of trauma-informed care and its importance in mental health interventions. Answer. Trauma-informed care (TIC) is an approach to providing mental health services that acknowledges the prevalence of trauma and its impact on individuals' physical and emotional well-being. It emphasizes safety, trust, empowerment, and collaboration. The key principles of trauma-informed care include safety, ensuring that the physical and emotional environment is safe for clients, free from re-traumatization. Trustworthiness, building trust between the healthcare provider and the patient, ensuring transparency about treatment and processes. Choice, providing clients with options and involving them in decision-making processes regarding their treatment. Collaboration, encouraging collaboration between clients and healthcare providers, recognizing the client's expertise in their own experience. This approach is particularly crucial for individuals with histories of trauma, such as survivors of abuse or domestic violence. According to the National Center for Trauma-Informed Care, NCTIC, implementing trauma-informed practices can improve the effectiveness of mental health interventions and help individuals feel respected and understood, reducing the likelihood of re-traumatization. Mr. Thompson is a 65-year-old man who visits his primary care physician after experiencing symptoms of depression such as persistent sadness, lack of interest in activities, and sleep disturbances. His doctor suspects he may also be dealing with early-onset dementia. What steps should his primary care physician take to manage his mental health care, and how can collaborative care models improve his treatment? Answer. Mr. Thompson's primary care physician should take a systematic approach to diagnosing and managing his mental health. First, the doctor should screen for depression using standardized tools such as the PHQ-9 Patient Health Questionnaire 9 to confirm the diagnosis. Conduct a thorough assessment to rule out other potential causes of symptoms such as medical conditions, e.g. hypothyroidism, neurological disorders. Collaborate with a specialist, e.g. geriatric psychiatrist or neurologist, to assess the possibility of dementia or any co-occurring conditions. Given the complexity of mental health and cognitive disorders in elderly patients, a collaborative care model (CCM) would be effective. This model involves integration of care, coordinating between primary care physicians, mental health professionals, and specialists ensures that all aspects of the patient's care are addressed. Shared care plan, a team-based approach where the physician, mental health counselor, and possibly a care manager work together to develop a comprehensive treatment plan that includes pharmacological and non-pharmacological interventions. Regular follow-ups, frequent monitoring of Mr. Thompson's progress, and adjustments to his treatment plan as needed. Patient-centered care, ensuring that Mr. Thompson's preferences, concerns, and personal goals are taken into account in his treatment plan. By involving a team of healthcare professionals, collaborative care can significantly improve outcomes in managing both mental health and cognitive conditions, ensuring that all aspects of Mr. Thompson's health are addressed. Discuss the global prevalence of mental health disorders and how different risk factors, such as genetics and trauma, contribute to mental illness. Answer. Mental health disorders are prevalent globally, affecting approximately 1 in 4 people at some point in their lives. The World Health Organization, who estimates that around 450 million people worldwide suffer from mental health conditions. The prevalence of specific disorders varies across regions, but depression, anxiety, schizophrenia, and bipolar disorder are some of the most common. Several key risk factors contribute to the onset of mental illness. Genetic factors. There is substantial evidence that certain mental health disorders, such as schizophrenia and bipolar disorder, have a genetic component. Trauma and adverse childhood experiences, ACEs. Early life trauma, such as abuse, neglect, or witnessing violence, is strongly associated with the development of mental health issues later in life. Environmental factors. Stresses such as poverty, social isolation, and living in areas with high levels of violence can increase the risk of developing mental illness. Substance abuse. The use of substances such as alcohol, tobacco, and illicit drugs can increase the risk of both mental health disorders and co-occurring conditions like depression or anxiety. Explain the ethical and legal considerations that healthcare providers must take into account when treating individuals with mental health conditions, particularly when involuntary treatment is necessary. Answer: involuntary treatment is a complex issue in mental health care, often raising significant ethical and legal concerns. Healthcare providers must balance the rights of individuals with the need to provide care, especially when the person is at risk of harm to themselves or others. Several key ethical and legal considerations include patient autonomy versus safety. Healthcare providers must respect the patient's right to make decisions about their treatment, a principle known as autonomy. However, if a patient is unable to make informed decisions due to their mental state, e.g., in cases of severe psychosis, the provider may need to prioritize safety and consider involuntary treatment. Informed consent. Even in cases of involuntary treatment, healthcare providers should strive to obtain informed consent, explaining the nature of the treatment, its risks and benefits to the patient whenever possible. Legal frameworks. Many countries have specific laws and guidelines governing involuntary treatment. For example, in the United States, the Mental Health Parity and Addiction Equity Act (MHPA) and state-specific mental health laws provide legal standards under which involuntary treatment can occur. These laws generally require judicial hearing or certification by a mental health professional that the individual is a danger to themselves or others. The right to appeal. Individuals subjected to involuntary treatment often have the right to appeal the decision in court, and healthcare providers must be prepared to support this process while respecting the legal rights of the patient. Ethical principles must guide the healthcare provider's decision-making process to ensure that the treatment is both legally sound and morally justified. How does climate change impact public health, and what are the most vulnerable populations to climate-related health risks? Answer: climate change affects public health in numerous ways, including extreme weather events. Increased frequency and intensity of heat waves, hurricanes, and floods pose direct threats to health by increasing injuries, heat-related illnesses, and fatalities. Vector-borne diseases. Changes in temperature and precipitation patterns can expand the geographic range of vectors like mosquitoes, which spread diseases such as malaria, dengue, and Zika virus. Air quality. Increased air pollution, including smog and allergens, exacerbates respiratory conditions like asthma and bronchitis. Waterborne diseases. Changes in rainfall patterns and floods can compromise water quality, leading to outbreaks of diseases like cholera and typhoid. Vulnerable populations at greater risk from climate-related health risks include low-income communities. These populations often have fewer resources to cope with the impacts of climate change, including inadequate housing, limited access to healthcare, and lower levels of preparedness for extreme weather events. Children and elderly individuals. These groups are particularly susceptible to heat-related illnesses, respiratory problems, and infectious diseases. Indigenous populations. Many indigenous communities are located in areas directly affected by climate change, such as coastal or rural regions, and face greater challenges in accessing healthcare and adapting to environmental changes. Mitigation and adaptation strategies, including strengthening health systems, improving disaster preparedness, and reducing emissions, are critical in addressing these health impacts. What role does community-based mental health care play in improving mental health outcomes, and what are the key components of an effective community mental health program? Answer: community-based mental health care is a critical approach to improving access to and quality of mental health services, especially in underserved areas. It emphasizes the delivery of mental health services in local settings, making care more accessible, culturally relevant, and integrated with other social services. The key components of an effective community mental health program include accessibility, ensuring that services are available within the community, reducing the need for patients to travel long distances. Cultural competence, tailoring services to meet the cultural, linguistic, and social needs of diverse populations. Prevention and early intervention, focusing on preventing mental health issues through education, early detection, and prompt treatment. Multidisciplinary teams, including various healthcare professionals such as psychiatrists, social workers, and counselors, who work together to address the wide-ranging needs of individuals. Integration with other services, linking mental health care with other essential services like housing, substance abuse treatment, and social services. What is the significance of the National Mental Health Policy in shaping mental health services, and how has it evolved in the last decade? Answer: the National Mental Health Policy provides the framework for mental health care delivery and guides the development of programs, laws, and funding for mental health services. The policy focuses on ensuring equitable access to mental health services for all populations, including those in rural and underserved areas, reducing stigma around mental illness, and promoting public awareness campaigns to encourage individuals to seek help. Integrated care, emphasizing the integration of mental health services into primary care and general healthcare settings, reducing the fragmentation of services, prevention and promotion, focusing on early intervention, community support, and the prevention of mental health issues. Over the last decade, the policy has evolved to prioritize human rights, recognizing the rights of individuals with mental illnesses and ensuring they have access to adequate care, recovery-based approaches, shifting from a medical model to one that focuses on holistic care and the recovery process, emphasizing rehabilitation, social reintegration, and empowerment, collaborative care, a push toward multidisciplinary teams that work together to provide more effective care. The growing recognition of mental health as a critical component of overall public health has led to substantial policy improvements globally. What are the psychological and social impacts of chronic diseases, and how can public health interventions help address these challenges? Answer: chronic diseases such as diabetes, heart disease, and cancer can have profound psychological and social impacts on individuals. These include psychological distress. Chronic illnesses often lead to feelings of anxiety, depression, and frustration due to long-term pain, limitations, and the uncertainty of disease progression. Social isolation. Individuals with chronic diseases may struggle with maintaining social relationships due to physical limitations or the need for frequent medical care. Economic burden. The cost of treatment, lost productivity, and caregiving responsibilities can create significant financial strain on both individuals and families. Public health interventions to address these impacts include mental health support, offering counseling services, cognitive behavioral therapy, and peer support groups to help individuals manage the emotional burden of chronic illness. Health education, providing education on disease management and healthy lifestyle choices to improve quality of life and reduce complications. Social support programs, encouraging the development of support groups, community activities, and caregiver networks to reduce isolation and promote social inclusion. Access to affordable care, ensuring that individuals have access to the necessary healthcare services, including treatment for both the chronic condition and associated mental health issues. These interventions can improve both the psychological well-being and the overall quality of life for individuals with chronic diseases. How can mental health awareness campaigns effectively reduce stigma, and what strategies have proven successful in encouraging individuals to seek help for mental illness? Answer: mental health awareness campaigns are essential in reducing stigma and encouraging individuals to seek help. Effective campaigns include public education, providing accurate information about mental illness, its prevalence, and the effectiveness of treatment can dispel myths and misconceptions. Campaigns should emphasize that mental health is just as important as physical health. Personal stories, featuring individuals who have experienced mental health challenges and have successfully managed them through treatment, helps normalize the experience and humanizes the issue. Media and celebrity endorsements. Celebrities and public figures who speak openly about their mental health struggles can create a powerful ripple effect, encouraging others to seek help. Targeted outreach. Campaigns should reach out to specific groups that may be more vulnerable to mental health issues, e.g., adolescents, veterans, or minority populations, and address their unique challenges in accessing care. Support services. Providing accessible, confidential, and affordable mental health resources helps individuals feel comfortable reaching out for support. How do the concepts of incidence and prevalence differ, and what is the importance of understanding both in public health surveillance? Answer: incidence refers to the number of new cases of a disease or condition that develop within a specific time period in a population at risk. It is a measure of the risk of developing the disease. Prevalence, on the other hand, refers to the total number of cases, new and existing, of a disease in a population at a given point in time. It is a measure of the burden of disease in a population. Understanding both is critical in public health for resource allocation, planning interventions, and measuring the effectiveness of public health programs. For example, high incidence rates might indicate a need for immediate intervention to prevent new cases, while high prevalence may suggest a need for long-term care and management for those already affected. Key guidelines laws. The Centers for Disease Control and Prevention (CDC) guidelines on disease surveillance emphasize the use of both incidence and prevalence data to understand the scope of health problems. Public health law requires accurate disease reporting to track both incidence and prevalence for proper epidemiologic investigation and response. What are the key differences between cohort, case control, and cross-sectional studies, and what are the advantages and limitations of each in investigating public health issues? Answer: cohort studies follow groups of individuals over time to see how exposure to certain factors affects the risk of developing a disease. They are prospective in nature and are useful in studying rare exposures and determining the incidence of disease. However, they are time-consuming and expensive. Case control studies compare individuals with a disease cases to those without controls, looking retrospectively to identify factors that may have contributed to the disease. These studies are efficient and less expensive, but may be prone to recall bias. Cross-sectional studies assess the prevalence of a disease or condition at a specific point in time, providing a snapshot of the population. They are inexpensive and quick to conduct, but cannot determine causality. Each study design has its strengths and limitations, which should be considered when designing public health research or intervention strategies. Key guidelines laws. Ethical guidelines from the National Institutes of Health (NIH). Mr. Perez works as a public health officer in a large metropolitan area and has just received a report about an unusual increase in the number of people with severe gastrointestinal illness. What steps should Mr. Perez take to investigate this outbreak, and what control measures should be considered? Answer: Mr. Perez should follow a structured approach to investigating the outbreak. Case definition: define the disease by specific clinical, demographic, and geographic criteria. Hypothesis generation: based on the initial data, form hypotheses about potential sources or causes. Case finding: identify additional cases through active surveillance and record keeping. Epidemiologic study: conduct case control or cohort studies to explore possible exposures or risk factors. Control measures: implement isolation of affected individuals, quarantine if necessary, and consider vaccination or prophylaxis if applicable. In this case, ensuring proper food handling and sanitation measures could help prevent further spread. Control measures must be in line with public health laws, such as those enforced by the CDC and WHO for containment and response. What are the key standards for air and water quality set by the Environmental Protection Agency (EPA), and how do these standards help mitigate public health risks? Answer: the PA sets air quality standards under the Clean Air Act, which specify acceptable levels of pollutants such as particulate matter, ozone, sulfur dioxide, and nitrogen dioxide. These standards are designed to protect public health, particularly vulnerable populations like children and the elderly, from respiratory and cardiovascular diseases. Similarly, the EPA regulates water quality standards under the Safe Drinking Water Act, ensuring that public water supplies meet safety criteria to prevent waterborne diseases such as cholera and giardiasis. These standards help reduce exposure to harmful pathogens and chemicals in water. Key guidelines laws. The Clean Water Act and the Clean Air Act require compliance with these standards to maintain public health. WHO guidelines provide global recommendations that align with EPA standards to ensure safe environmental health. How do worker protection regulations like those from OSHA, Occupational Safety and Health Administration, help mitigate health risks in the workplace, and what are some common workplace hazards covered by these regulations? Answer: OSHA regulations are designed to ensure that workplaces are free from recognized health hazards. These regulations cover a broad range of potential workplace hazards, including chemical hazards, exposure to toxic chemicals like asbestos or lead, physical hazards, risks from noise, temperature extremes, or machinery, ergonomic hazards, repetitive motion injuries or poor posture. OSHA requires employers to provide a safe working environment, conduct hazard assessments, and implement safety programs, including protective equipment and proper training for workers. Key guidelines laws. The Occupational Safety and Health Act (OSHA) Act mandates that employers must provide a workplace free of recognized hazards that could cause serious harm. OSHA's General Duty Clause holds employers accountable for ensuring safety in the workplace. What is the role of public health professionals in addressing the health impacts of climate change, and what adaptation and mitigation strategies should be implemented to protect vulnerable populations? Answer: Public health professionals play a crucial role in addressing the health impacts of climate change, such as heat stress, air pollution, and vector-borne diseases. They must adaptation strategies, develop infrastructure to manage heat waves, e.g., cooling centers, improve disease surveillance systems for vector-borne diseases, and create public health campaigns to educate populations on climate-related health risks. Mitigation strategies advocate for policies that reduce greenhouse gas emissions, such as promoting renewable energy sources, improving energy efficiency, and encouraging sustainable agriculture. Public health professionals should also focus on vulnerable populations, including the elderly, children, and those with pre-existing conditions who are more likely to suffer from climate-related health impacts. Key guidelines laws. WHO guidelines on climate change emphasize the need for health systems to adapt to emerging challenges posed by climate change. How does the host agent-environment interaction influence the transmission and severity of infectious diseases? Answer. The host agent environment model is fundamental to understanding infectious disease transmission. This model explains how the interaction of the host e.g. human, the agent e.g. bacteria, virus, and the environment e.g. sanitation, climate, vector presence contributes to disease spread and severity. Host individual factors such as immunity, age, and pre-existing conditions can influence disease susceptibility. Agent. The characteristics of the infectious organism, including virulence, mode of transmission, and resistance to treatment, determine the disease's severity. Environment. Environmental factors such as water quality, sanitation, climate, and the presence of vectors e.g. mosquitoes can facilitate or hinder disease transmission. Understanding these interactions allows public health professionals to design effective prevention and control strategies targeting each aspect of the model. Key guidelines laws. CDC guidelines focus on controlling environmental and host-related factors to prevent the spread of infectious diseases. How do risk management frameworks assist public health professionals in mitigating environmental health hazards, and what are the steps involved in a typical risk assessment? Answer. Risk management frameworks are used to assess and control environmental health hazards by systematically evaluating potential risks. The key steps in a risk assessment include hazard identification, determining the nature of potential environmental hazards, e.g. air pollutants, chemicals, dose response assessment, evaluating the relationship between the dose of the hazard and the likelihood of adverse health effects, exposure assessment, measuring or estimating the level of exposure to the hazard in a population, risk characterization, estimating the health risk based on the combined information from the first three steps. Once the risk is characterized, the next step is to implement control measures, such as regulation of pollutants or implementation of public health interventions. What are the key components of surveillance systems in tracking infectious disease outbreaks, and how do reporting guidelines help in managing public health responses? Answer. Surveillance systems involve the continuous collection, analysis, and interpretation of health data to detect outbreaks early. Key components include case detection, identifying unusual patterns or increases in disease occurrence, data reporting, providing accurate and timely data to health authorities, analysis, analyzing trends to understand the nature and potential source of the outbreak, reporting guidelines, such as those from the CDC and WHO, ensure consistency and accuracy in data collection and facilitate coordination between local, national, and global health bodies. Key guidelines laws. International health regulations require countries to report outbreaks to the WHO to ensure coordinated global response. CDC and NIH guidelines emphasize the importance of timely and accurate reporting in outbreak management. What are the public health implications of exposure to environmental pollutants such as air and water contaminants, and what measures can be implemented to reduce health risks? Answer. Exposure to environmental pollutants, such as particulate matter in the air and heavy metals in water, has significant health implications, including respiratory diseases, cardiovascular conditions, and cancer. To reduce health risks, public health professionals must regulate pollution, implement and enforce air and water quality standards, public education, educate communities about reducing exposure to pollutants, e.g., air quality advisories, water filtration, monitoring and reporting, continuously monitor environmental pollutants and ensure that public health advisories are issued promptly. Key guidelines laws. Clean Air Act and Safe Drinking Water Act outline national standards to regulate air and water quality. WHO provides international guidance on managing the health effects of environmental pollution. You are analyzing a dataset of test scores from a public health survey. The scores have a mean of 75, a median of 78, and a mode of AC. The standard deviation is 8. Based on these values, which measure of central tendency would you rely on if the dataset is skewed to the right, and why? Answer: when the data is skewed, the mean can be distorted because it is influenced by extreme values. In this case, because the dataset is skewed to the right, positively skewed, the median is a more reliable measure of central tendency because it is not affected by extreme high values as the mean is. The mode is also useful, but in this case, the median offers a more accurate representation of the center of the data. Guidelines: the mean is sensitive to skewed distributions. The median is robust to skewness and is often the preferred measure in skewed distributions. In cases of right-skewed data, the mean-median mode is a common pattern. In the ECA clinical trial, a researcher uses a frequentist approach to estimate the risk of a disease based on data from a sample. How would the conclusions differ if a Bayesian approach were used instead, considering prior beliefs about the disease risk? Answer: frequentist approach. In this approach, the probability is interpreted as the long-run frequency of events. In the clinical trial, the researcher would calculate the likelihood of the observed data given a hypothesis and use statistical tests, e.g., p-values, to draw conclusions about the population. Bayesian approach. The Bayesian approach incorporates prior beliefs or prior distributions about the risk, which are updated as new data comes in to calculate the posterior probability. This approach allows the researcher to consider previous knowledge or expert opinion in the analysis, leading to potentially different conclusions based on the prior belief. Key differences: frequentist, data-driven, no prior knowledge considered. Bayesian incorporates both prior knowledge and observed data to form conclusions. Guidelines: Bayesian statistics uses prior distributions and posterior updating. Frequentist statistics is based on sampling distributions and hypothesis testing. Dr. Thompson is managing a health promotion program focused on smoking cessation in a rural community. After implementing the program, he evaluates both the immediate outcomes, number of people who quit smoking in the first 3 months, and long-term impact, number of people who maintain quitting for over a year. What type of evaluation should Dr. Thompson use, and what are the critical factors to consider for assessing program success? Answer: Dr. Thompson should use a comprehensive evaluation approach that includes both process and outcome evaluations. Process evaluation. This assesses how the program was implemented, including fidelity to the planned activities, the reach of the program, and the quality of delivery. Outcome evaluation. This focuses on the short-term and long-term outcomes of the program, such as immediate smoking cessation rates and sustained quitting behavior after 1 year. Critical factors to consider include reach and engagement. Was the target population effectively reached? Effectiveness. Did the program achieve the desired short-term and long-term outcomes? Sustainability. Can the program be continued or scaled effectively? Guidelines. Process evaluation examines the execution of program activities. Outcome evaluation assesses the program's success in achieving its intended health outcomes. In the ECA Public Health Study on vaccine efficacy, a researcher plans a study with a sample size of 200 participants and sets the significance level A to 0.5. If the effect size is small, how does the power of the study change, and what adjustments can the researcher make to improve it? Answer: the power of a study is the probability that it will detect an effect if one truly exists. Power is influenced by the sample size significance level A and the effect size. If the effect size is small, the study will have low power to detect a statistically significant result, meaning that even if there is an actual effect, the study may fail to detect it. To increase power, the researcher can increase the sample size. Larger sample sizes reduce variability and increase the likelihood of detecting a true effect. Increase the significance level A. This makes the test more sensitive to detecting effects, but also increases the risk of type I errors, false positives. Use a more powerful test. If applicable, switching to a more sensitive statistical test can also increase power. Guidelines. Power is typically set at 0.8, 80%, meaning there's an 80% chance of detecting a true effect. A larger sample size is the most effective way to improve power in small effect scenarios. In an observational study investigating the relationship between diet and heart disease, why is it more difficult to establish causality compared to an experimental study, and what measures can researchers take to strengthen their evidence? Answer: in an observational study, researchers observe and record information without manipulating the environment or treatments. The difficulty in establishing causality arises because of potential confounding variables. Other factors that might influence both diet and heart disease, such as physical activity, genetics, or socioeconomic status. In an experimental study, researchers can manipulate the exposure, diet, and control for confounders through randomization, thus allowing a clearer interpretation of cause and effect. Measures to strengthen evidence in observational studies adjust for confounders using statistical methods such as multivariable regression or stratification, longitudinal design. Use cohort studies to track the relationship over time. Use of control groups and careful matching of subjects. Guidelines. Confounding must be controlled to infer causality. Experimental studies are more effective at determining causality due to the controlled nature of the design. What is the difference between a type I error and a type II error, and how do they impact public health decision-making? Answer: type I error, false positive. This occurs when a study incorrectly rejects the null hypothesis, suggesting that there is an effect or association when none exists. In public health, this could lead to the implementation of an intervention that is not actually effective, wasting resources. Type I, false negative. This occurs when a study fails to reject the null hypothesis, suggesting that there is no effect when one actually exists. In public health, this could result in missed opportunities to address a significant health issue. Guidelines. Type I risk is controlled by the significance level A. Type I risk is minimized by ensuring adequate power and sample size. A community health educator is preparing materials for a low-literacy population on the topic of diabetes management. What factors should be considered in designing these materials to ensure they are effective? Answer: to ensure the materials are effective for a low-literacy population, the educator should consider simple language, use clear, plain language and avoid medical jargon, visual aids, incorporate diagrams, pictures, and simple charts to explain concepts. Cultural relevance. Ensure that the materials are culturally sensitive and appropriate for the community. Readability. Use fonts that are easy to read and ensure there is sufficient contrast between text and background. Guidelines. Health literacy refers to the ability to understand and act on health information. Materials should be accessible for all literacy levels, focusing on clarity and engagement. A city council is considering a new development project that includes the construction of a highway through a residential area. As a public health professional, how would you conduct a health impact assessment here for this project, and what key factors would you assess? Answer: to conduct a health impact assessment here, follow these key steps. Screening. Assess if the project has the potential to impact public health. The construction of a highway likely affects air quality, traffic accidents, noise pollution, and mental health. Scoping. Identify which health impacts are likely to occur and prioritize them. G. Respiratory issues from air pollution, stress from noise, safety risks from increased traffic. Assessment. Collect data and analyze potential health risks using both qualitative and quantitative methods. This may include reviewing health records, community surveys, and environmental data recommendations. Develop strategies to mitigate negative impacts, such as soundproofing for residences, improving traffic safety measures, or promoting the use of public transportation. Monitoring and evaluation. Implement a plan to monitor health outcomes as the project progresses and evaluate the success of mitigation strategies. A study shows that minority populations in a city are at high risk for chronic diseases such as diabetes and hypertension. What strategies should public health professionals implement to reduce these health disparities, and how can they engage the affected communities? Answer: to reduce health disparities, public health professionals can implement the following strategies. Targeted health education. Provide culturally appropriate education on chronic disease prevention, tailored to the specific needs and understanding levels of minority populations, access to care. Improve access to healthcare by establishing community health centers in underserved areas, offering mobile clinics, and ensuring that healthcare providers are culturally competent. Policy advocacy. Advocate for policies that reduce social determinants of health such as income inequality, poor housing conditions, and limited access to healthy foods. Community engagement. Involve community members in the planning and implementation of health programs to ensure the initiatives are relevant and accepted by the population. Utilize community health workers from within these populations to build trust and facilitate outreach. Data collection and monitoring. Regularly collect and analyze health data to monitor progress and identify ongoing health inequities. You are tasked with designing a health communication campaign to encourage people to increase physical activity in a community with high obesity rates. Applying the social cognitive theory, SCT, what strategies would you use to motivate behavior change? Answer: the social cognitive theory, SCT, emphasizes the role of observational learning, self-regulation, and the influence of the environment on behavior. Strategies to motivate behavior change using SCT include modeling. Use role models and peer influence to show the benefits of physical activity. Show individuals from the community who have successfully incorporated exercise into their daily routine. Self-efficacy. Build participants' confidence in their ability to increase physical activity by starting with small, achievable goals and providing positive reinforcement when goals are met. Reciprocal determinism. Modify the environment to make physical activity more accessible, such as providing safer places to walk or bike and promoting community-based exercise groups. Outcome expectations. Clearly communicate the benefits of physical activity, such as improved health and increased energy, to strengthen the belief that exercise will lead to positive results. Self-regulation. Encourage individuals to track their physical activity and set goals. Use mobile apps or fitness trackers to help them monitor progress.